morning. You are listening to Complete Health with Dr. Mike Rogers. We all know the feeling associated with tooth pain. You take a sip of your hot morning coffee and immediately you feel a zing of pain. Or you clench your teeth and get a sharp jolt that makes you wince. Or perhaps you have a constant toothache that just won't go away. No matter which type of tooth pain you have, you want to know what's happening, and more importantly, you want to fix it. This is April from Complete Health Dentistry. I am here with Dr. Mike Rogers, who's going to provide you with some of the main causes behind tooth pain. Good morning, Dr. Rogers.
Good morning, April. Good morning, Northeast Pennsylvania.
Thank you for joining us for our second show of the new year, and I want to take this opportunity to wish everyone a happy new year. We have so many exciting things to share with you over the next few months, so be sure to tune in every Saturday morning at 8 a.m., especially next week when we have a huge announcement to make.
Ooh, that sounds exciting. We'll talk a little more about that later, but first let's get to talking about tooth pain. Can you give our listeners some insight on the basic causes of tooth pain?
I sure can, but what I'd like to preface or bring up is there's a lot of reasons for tooth pain, but if something persists or is present for a period of time, say a week or 2 weeks, you really should come in, give our office a call. Come on in and let's take a look at it, because something's not right if you've got a persistent toothache or tooth problem. So give us a call and we'll get you in and see what's going on first.
Okay. Well, can you tell us some of the main causes of tooth pain?
I'll start with the big one. The big one is cavities.
That sounds painful.
It can be.
How do you get cavities?
Well, it's from feeding the bacteria that are in our mouth. I know we've talked in the past about the bacteria that can create harmful problems to the rest of your body. There's different bacteria in our mouth that can create harmful effects to your teeth. And what we do is what we eat and what we drink can feed those bacteria, and the bacteria then create acids that break down the enamel.
Oh, okay. So what happens then?
As the acids sit there longer and longer period of time, it erodes away at the enamel or the outer tooth layer of the tooth. And then once it gets into the inner tooth structure, it can progress more rapidly.
So bacteria is one way we can get cavities. What other ways can we get cavities?
The risk factors for decay, as we talked about, sugary and carbonated beverages and foods. Carbohydrates, because they break down to simple sugars, and once again those things feed the bacteria. Poor home care, not brushing and flossing like we're supposed to, inadequate brushing, tooth location and tooth position can also.
What do you mean by tooth location?
Well, there too, if you've got a tooth that's way in the back and it's very hard for you to reach, then it's going to be more susceptible to decay. So you got to make sure you get all of those. Also, tooth position, if your teeth are crowded or overlapped, those areas of overlapping where it's difficult to reach and get in between is going to make it harder to keep clean, so it can decay easier. And then also something as like a gag reflex. If you've got a severe gag reflex, it's going to be harder to get, say, to the inside inner surfaces of those lower teeth if you're prone to gagging from brushing.
Okay. Are there any other ways that we can get cavities?
Yeah, I mean, we can get cavities from just even starting as an infant or a newborn, just by letting your child go to bed with a bottle, a formula or whatever. And even though they may not have sugar in the formula, there is carbohydrates in that formula, which is going to break down to a simple sugar. So sending your child to bed is setting them up for problems. The other thing is babies aren't born with the bacteria that cause decay in their mouths. And so where they get this bacteria from is from their parents. Their parents
What do you mean?
Great question. And what it is when we taste the food and hand it off to the baby or give it to the baby or blow on the food, the bacteria in our mouth is going on to that food, and we're inoculating our children with the bacteria from us. And so we're giving them the bacteria now that are creating or can create decay and gum disease and all that.
That's awful. How can we prevent that?
Well, once again, just good home care on your part, so you're not giving your bacteria to your toddler or infant, and there too, just being cognizant that you could be spreading this to your child. Other things that can cause cavities: dry mouth, diabetes.
What do you mean by dry mouth?
Well, dry mouth, as we mature, our saliva starts to get less, or even medications that you may be on can cause you to dry up or dry mouth.
And how does that cause cavities?
Well, as your mouth dries out, the bacteria are incorporated into a sticky plaque. It's a mat, say, of bacteria that stick to your teeth. And since now your saliva is not flushing the bacteria away, it's allowing the bacteria to sit there and work even more effectively, meaning more aggressively, and can create cavities easier.
Oh, okay.
Other things, as I mentioned, the age, very old are more susceptible to root surface decay because our gums can recede, and very young are more susceptible to decay because the enamel in baby teeth isn't designed like adult teeth. Frequent smoking and chewing tobacco, secondhand smoke can cause decay.
How does secondhand smoke cause tooth decay?
Well, smoking and secondhand smoke, it's one of those things that the nicotine in that is going to dry out the mouth. And as we just talked about, a dry mouth is going to increase the aggressiveness of the bacteria and what they produce, the acids. And so that's going to cause your teeth to break down quicker.
So you're saying just breathing in someone else's smoke is going to dry your mouth out?
Correct.
Wow.
Correct. And so not using fluoride products, fluoridated products, or having fluoride in your water, that's also going to increase the likelihood of decay.
So fluoride helps prevent decay?
Yes, it does.
Okay.
Yes, it does, April. And other things that can create cavities or as I mentioned, secondhand smoke. Also, alcohol and drugs can do that by drying out the mouth. Once again, we discussed that there. Fillings can also, large fillings can increase the likelihood of decay.
Well, isn't a filling to take care of a cavity?
Yes, it is. But what happens is that junction between the filling and the tooth over time can break down or can collect plaque and bacteria in that junction. And that there can allow the bacteria to sit and harbor the same effect. So, yes, fillings are designed to protect the teeth or help the teeth from the decay. But when it gets so big and there's so many edges to the filling, it can actually be a detriment to the tooth.
So what can we do to prevent that?
That's a great question. That's going to be in a little bit later. We're going to talk on what we can do other than just super big fillings.
Okay. All right, well, when we come back, we will talk more about the causes of tooth pain with Dr. Mike Rogers.
Complete Health Dentistry, transforming your health for a lifetime.
Most of us make New Year's resolutions each year and struggle to keep them. Make this the year to get healthy from head to toe. Exercising and eating healthy are givens. But what about your health when it comes to your teeth and gums? Studies have shown a link between gum disease and many medical conditions, including heart disease, diabetes, arthritis, stroke, and pancreatic cancer. Dr. Michael Rogers treats more than just your mouth. Along with making sure your teeth and gums are healthy, you will receive an oral cancer, blood pressure, and bacterial screening to see how well you are able to fight off illness both in your mouth and body. Call today for your new patient experience and make this the year of better health. 570-253-5000.
Complete Health Dentistry, transforming your health for a lifetime.
New patients are always welcome.
Welcome back. We're here today with Dr. Mike Rogers talking about the common causes of tooth pain. Dr. Rogers, what are some other causes of tooth pain? We talked about cavities in our last segment. What else?
Fractured teeth are another cause for tooth pain, or problems in your mouth.
Okay, so with a fractured tooth, what causes pain with that?
Once you break through that outer layer of tooth surface, the inner tooth surface is more sensitive. And once you get down into that, just with a crack or a break, it's going to make the tooth sensitive.
Okay, I see.
Another one would be broken fillings. For the same reason, the filling goes down into the inner tooth structure. And once that filling breaks out, you could have sensitivity because of, or pain, because the filling is no longer protecting the inner tooth structure.
Okay, and what do we do for that?
Well, one, you give our office a call if you have a broken filling or a broken tooth, and we'll get you in and take care of that. But it could be as simple as just a filling, or it may need to be more involved. It would all depend on what we find when we get in there. But the fillings themselves, like we talked about, can also be a cause for tooth pain. I know you put a filling to protect it, but...
You mean even if it's not broke?
Even if it's not broke, exactly. The depth of the filling can increase sensitivity on the tooth, and it could take a while for that to subside. If the bite isn't exactly right, don't just assume it's going to settle in. It can actually, having trauma to your tooth.
What do you mean it's going to settle in?
Well, a lot of people will say, you know what, when they have a filling done, they'll say, oh, I just thought it was a little bit off and it was going to feel better after time. I'll get used to it. Don't get used to it, because today's modern materials aren't real forgiving in getting used to it. It can make your tooth sensitive from the constant hitting or tapping, even though it may be light or slight. And that can make your tooth very sensitive.
So if you've had a filling recently and you have pain, it may be just that the filling itself needs to be smoothed down. It's too high.
Yep, just an adjustment could a lot of times eliminate that sensitivity. So once again, don't just step over it and let it go, because it could lead to worse problems. It could lead to the tooth dying or you having a lot more severe problems, in some cases even lose the tooth.
Okay, so I'm assuming when you have a filling done, the main thing here is there should not be any more further pain.
Correct.
Okay. Well, what are some other causes then of tooth pain?
Gum recession, meaning the gum shrinking down. As we mature, we do lose some gum retention or gum height. The old adage of getting long in the tooth isn't so much the teeth are getting longer, it's the gums are receding. But that can create tooth sensitivity because root surfaces are more sensitive than the enamel-covered visible part of the tooth.
Okay, so that could be where my drinking a sip of my coffee gives me a zing.
Yes, it could be, and so once again, but just don't assume it's just a temporary thing. You want to come in and get it evaluated to make sure it's not something that's more significant. Gum disease can also be a source of tooth or mouth pain as well, because the gums pull away from the tooth. Cold and hot can get down alongside the root surface and create that sensitivity as well. Mm-hmm. And there too, there's more significant and other issues that we have talked about in previous episodes about gum disease and how it affects your overall body. Trauma to your teeth. If you get hit in the mouth with something, bite into something wrong, even though you may not have cracked a tooth or hurt a tooth, visibly, the trauma to the tooth itself could hurt the ligaments that hold the tooth in place and create pain or discomfort.
Ouch.
Exactly. Grinding and clenching. And that in itself doesn't sound like it's painful, but when you grind and clench, you're wearing tooth structure away. And once you wear through that outer layer of enamel, it can certainly create pain and discomfort. In one of our future episodes, or multiple future episodes, what we're going to be talking about are symptoms or what causes grinding and clenching. TMJ problems, jaw joint problems can cause it. Sleep disorders, sleep issues, sleep apnea can cause grinding and clenching. So there's a lot more involved with just stepping over this grinding, clenching, and wearing of your teeth down. So
I know there's a lot of things that cause that, but do you have any quick ideas on how if I was to clench or grind at night, what should I do?
Well, it could be as simple as a bite guard or a night guard that we can make, or it may be more involved, and that's why I'm saying in some instances, if you've got pain and discomfort that's going on, you don't want to just do a home remedy, because bigger things can come from it, more significant things. The bacteria in our mouth can create all kinds of medical problems, so you don't want to step over that. Clenching and grinding could be a symptom of a more significant thing, sleep apnea. And so sleep apnea can cause all kinds of health and medical problems. It can cause the significance of even death.
Wow. Okay.
A few other things that can create tooth and mouth pain, April, if there's an abscess or an infection. That's a significant one. And then, as I was already talking about, TMJ or TMD problems, jaw joint problems, that can create tooth and mouth pain as well. Oral cancer, mouth cancer, can cause tooth, mouth, jaw, gum, bone, everything pain. And so it's not something just to step over lightly just because it's something that's there and you really should have checked out.
Okay, that's great advice. Also, Dr. Rogers, from what I understand, there can be issues even without pain. Is that true?
Yes, there is. You can have cavities and not have any pain with decay. You can have TMJ problems. You can have clenching and grinding and still not have any pain when you've ground through that outer layer of enamel. So if you start to see where a breakdown or a filling comes out or something, even though there's no pain, give our office a call. Don't just step over it, because it can lead to other issues that are more significant.
Now, last week you talked about gum disease, and I know you said that doesn't always cause pain, but the things, if you have bleeding gums, and what else there? Because I know that doesn't always cause pain.
Right. Gum disease, some tooth problems don't cause pain at all. And so regular dental visits, regular checkups are certainly gonna help prevent them from becoming an issue. Also, we talked about earlier, because with oral cancer, you should really check and see, do you have any signs or symptoms of oral cancer? Because if you smoke, if you drink alcohol, HPV, human papillovirus, is also a significant issue on the oral cancer scene now. So, I mean, all of these things, doing a self-check, are there red or dry patches, red, white, dry patches that can cause any issues?
Okay. Well, when we come back, we're going to discuss what you should do if you're experiencing tooth pain.
Complete Health Dentistry. Transforming your health for a lifetime.
Uninterrupted, unhurried attention? Time to talk about your health, your smile, and how they affect you from head to toe? If stress-free dentistry is what you are looking for, visit Dr. Michael Rogers at Complete Health Dentistry of Northeastern Pennsylvania. We believe your mouth is the gateway to overall health. Complete Dental Health is the first line of defense against many diseases, including diabetes, heart disease, and cancer. In his state-of-the-art practice in Honesdale, Dr. Rogers offers the care you need to look and feel your best. From preventive care to implants, sleep apnea, and sedation, this is the premier dentistry you deserve. Call Dr. Rogers at 253-5000 and schedule your appointment. Just one rejuvenating visit and you'll be spoiled.
Welcome back. We're here today with Dr. Mike Rogers talking about the common causes of tooth pain. Dr. Rogers, how can our listeners prevent tooth pain?
That's a great question, April. Tooth decay and tooth pain prevention starts with regular maintenance, regular dental visits. Brushing and home care, brushing, flossing, taking care of your mouth is also a big thing. You should brush twice a day for at least 2 minutes. You should floss at least once a day to eliminate the bacteria and the plaque from in between your teeth as well. Other things, don't smoke. Don't smoke around your kids either, because as we discussed today, secondhand smoke can dry the people around you's mouth out and increase their likelihood of decay as well. limit sugar and carbohydrates. Limit snacking in between meals.
That's a tough thing to do.
It sure is. I'm always looking for stuff to nibble. And
So what if we have a sweet tooth and we like to snack in between meals? What can we do?
well, if you can find snacks with limited carbohydrates and limited sugars, more crunchy things, carrots, things like that. Popcorn even can help scrape the plaque and the bacteria off because it's more crunchy. But, if we can avoid all the additive stuff. Also, brushing between meals will certainly help. And added brushing, I know I said twice a day, but if you're a snacker, brush between meals. Also, drinking water can help eliminate some of the problems too, just because that's going to flush and wash things down, so it's not sitting on your teeth as long.
And that'll help with the dry mouth too, wouldn't it?
Yes, it would. Yes, it would. Another thing is to protect your teeth from fracture. We're heading into seasons, sporting seasons and things like that. You want mouth guards on your children and activities that you do like that to prevent your teeth from trauma and getting banged.
What's the best place to, or where's the best place to get a mouth guard?
Well, a lot of us dentists do make sports mouthpieces specifically for the athlete, so you can certainly come in and have one custom made, which is a great question. The other thing is, the key is just protecting the teeth from the trauma. Sharing food and utensils is another way to prevent, as we talked earlier today. When you share food and utensils, you're passing everybody that you're sharing with. You're passing them your bacteria, and they're passing it back to you.
So don't share is your recommendation.
Correct.
What about I know if I have something to drink, my kids like to take a sip.
Yeah, it sounds great, but once again, it's you've got to watch.
Non-alcoholic, of course.
Yeah. But on it at this point, it's one of those things that you've got to know yourself. If you're not the greatest at home care, do you really want to give that to someone else? So you've got to watch that. Dry mouth for medications. One, there's salivary substitutes. There's things that you can do, lemon water, things like that. And even though lemon water is acidic, there too, just drinking through that the tartness of it can make you have more saliva. Other things, xylitol products. There's gums, there's rinses, there's candies and things like that. And what's great about xylitol is, even though it's very sweet, it doesn't promote decay. The bacteria that are in our mouths can't use it to make the acids.
Thank you, doctor. Those were all great ways to prevent tooth pain. I hope everyone has gained something from our talk this morning. Doctor, I know you were also interested in spotlighting a procedure that you perform in your practice. What is it you'd like to spotlight today?
In our office, we use what's called the Velcro oral cancer detection system. And what it is it's a light that fluoresces in the mouth green. It makes the tissues, the gums, the tongue, and everything in the mouth look green. And we can determine there, using this appliance, that is there something that we need to investigate further? Does the color not match the area around it? And so instead of a traditional oral cancer exam catching things, say, at stage 2, stage 3, we can catch things earlier now with using this Velcro light. It can catch it at stage 1 or even...
So you can see things with this light that you can't see if I was to look in the mirror.
Correct. When you look in the mirror, that's a great question, because when you look in the mirror, you're seeing something that's already come to the surface. With this light, we're seeing it before it gets to the surface. So before something erupts, before we're finding it before the volcano erupts. And with oral cancer, the earlier detection you can get, the greater the likelihood of success of eliminating the problem. Early detection can lead to 80-90% success rate in longevity, whereas later detection, your success rate drops to 50%.
Wow, technology is amazing, and that's great that you have that. Now, How often should I have that Velscope screening?
Well, we do it at least annually. If someone has a high risk, meaning they smoke, they drink a lot of alcohol, or if they've had a cancer scare or they've had cancer before, things like that, we may want to talk about doing it more frequently. So it all depends on you. Everything is custom treatment planned, right, for what your needs are. It's not just a one-stop, everybody gets the same thing. Every person is an individual, and we got to look at it that way.
Okay. All right. Is there anything else you wanted to add about the Velscope?
You know what, April, from my heart, really, what you want to do is if you've got someone in your life that you really care about and you're concerned because they haven't been to a dentist in a while, there's things that we can look at and do it very effectively and very comfortably nowadays. So the fear that you've had in the past, the concerns you've had in the past from coming in. The other thing is, all of these things we're talking about, like I said, some areas of decay, gum disease, even cancers can show up and not be painful until it moves into later, deeper stages. And so what I'm here saying is, if you've got people that you care about, if you've got people that you love, get them into our office to really get a good exam if they haven't been in a while, or even if you're just looking for someone who really wants to help and wants to look at your well-being and how it affects you and the rest of the people around you, come on into our office and let's get this checked out.
So if you have any areas of concern that you'd like to have looked at, give us a call. This has been Complete Health Dentistry with Dr. Mike Rogers. This program airs every Saturday from 8 a.m. to 8:30 a.m. If you are experiencing tooth or mouth pain, give us a call, 253-5000. And join us next week for another visit with Dr. Mike Rogers on Complete Health.
And join us next week for a super duper fantastic awesome contest we are going to be promoting this year.
Oh, come on, Doctor. Can't you give a little more information to our listeners?
I wish I could, April, but you've got to come and join us next week.
Oh, all right. Well, I guess we'll all have to wait till next week on Saturday at 8 a.m. on 94.3 The Talker.
It's going to be worth the wait, April. I promise you.
Complete Health Dentistry, transforming your health for a lifetime.
Uninterrupted, unhurried attention? Time to talk about your health, your smile, and how they affect you from head to toe? If stress-free dentistry is what you are looking for, visit Dr. Michael Rogers at Complete Health Dentistry of Northeastern Pennsylvania. Complete Dental Health is the first line of defense against many diseases, including diabetes, heart disease, and cancer. In his state-of-the-art practice in Honesdale, Dr. Rogers offers the care you need to look and feel your best. From preventive care to implants, sleep apnea, and sedation, this is the premier dentistry you deserve. Call Dr. Rogers at 253-5000 and schedule your appointment. Just one rejuvenating visit and you'll be spoiled.
Transforming your health for a lifetime.
This is Dr. Mike Rogers from Complete Health Dentistry of NEPA. You can listen to this episode again, along with all the episodes of Complete Health, by going online to CompleteHealthDentistryOfNEPA.com. We've covered topics such as sleep apnea, diabetes, children's growth and development, women's health, and more. Listen anytime online. Just go to CompleteHealthDentistryOfNEPA.com or call us to set an appointment, 570-253-5000.
Complete Health Dentistry, transforming your health.